Welcome to Stand Up for Doctors. I'm your host, Kim Downey. Thank you very much for joining us. Today, we actually have a very special episode where I'm going to discuss how caring about your doctor gets you better care. And I'm going to talk about how I came to care about physician well-being, why are physicians experiencing burnout, why patients should care, some solutions, and what patients can do. And I'm happy to have my friend Pat Dunstan here with me today to listen as I share this story and this information. And Pat is a nurse, a lawyer, and a patient with Parkinson's. And I'm grateful to have you join us today. Thank you, Pat.
I am happy to be here, Kim.
To get started in regards to how I came to care about physician well-being, I'll give a very brief overview as I've also shared my story more extensively in what I titled the introductory episode, which can also be found on this YouTube channel, Stand Up for Doctors. So I'm a physical therapist by training, and I have extensive experience both as a healthcare professional and more recently as a patient. And I understand the current healthcare struggles from all perspectives. I had cancer 3 times recently over a 2-year period, and I experienced a complication from my first cancer surgery, resulting in permanent unintended consequences. I saw a total of 37 doctors during that time, and after a long period of constant health issues, I showed up for what I thought was finally going to be a routine imaging visit and a welcomed opportunity to see one of my wonderful doctors, and it was anything but routine. Another mass was found that day requiring yet another biopsy. This time it wasn't cancer, and my doctor wasn't there. And when I asked where he was, I was told that he died a month ago. And I couldn't believe it. I asked what happened, and they said they didn't know, and I fell apart. And I've come to know that he took his own life. And since then, I felt a calling to support doctors and to address physician well-being. Approximately 1 doctor dies by suicide every day. It's the highest suicide rate of any profession and more than twice that of the general population. I've had conversations with many physicians, including ones who have had suicidal ideations and ones who have attempted suicide and survived even multiple times. I've also had conversations with spouses of physicians who died by suicide, including my own. This is a real issue. This is a serious issue today. The average primary care physician has a panel of 2,300 to 2,500 patients. My understanding is that specialists can have a panel of nearly twice that number. When a physician takes his life, 2,000 to 4,000 patients lose their doctor. A good doctor is irreplaceable. If you want your doctor to be there for you when you need them, you need to understand how difficult things are for doctors right now and care about it so they can care for you. So why are physicians experiencing burnout? Even the use of the term burnout has been cause for debate for good reasons, which I won't get into here, though I'm happy to explain or discuss it with anyone who would like to reach out to me. The issues are multifactorial, and for the purposes of this talk, I'll share several different contributors, including loss of autonomy, administrative burdens, and moral distress and moral injury. In regards to loss of autonomy, doctors used to be in charge of their own schedules, controlling how many patients they saw, when they ate lunch, their personal time, etc. Their schedules are now largely dictated to them. They face intense pressure to produce RVUs, which is relative value units, having to see more and more patients in less time. And a couple examples are one doctor shared that he was expected to perform procedures continuously from 7 a.m. to 5:30 p.m. without a break. Even though everyone else on the team had a lunch break, he had to fight to eventually get one. Would you want to be the last procedure of the day for a tired and hungry doctor who had not been afforded even a 15-minute break? And another example, using myself as a PT, back in the day when we evaluated a patient, we determined the length of each session, which was typically 30 to 60 minutes, the frequency of the visits per week, which were typically 1 to 3 a week for outpatients, and the length of anticipated treatment, which was typically 2 to 8 weeks, and then would reassess if needed. Eventually, with changes in insurance and introduction of the EMR, electronic medical record, that changed. It's now dictated to us how long we're allowed to see our patients, from the length of each visit to the length of the treatment period. And it's the same for doctors. And these decisions are frequently based on the type of insurance the patient has, not what the patient needs or what is best for the patient. It's incredibly frustrating and disempowering for us as clinicians. Learning how to make those kinds of determinations is what we went to school for. When everything's dictated to you, it feels like time to make the donuts, like you're just hamsters or cogs on a wheel, that you're basically a production line for the system, versus being able to thoughtfully consider what's most beneficial for the patient. In regards to administrative burdens, there are so many frustrations with the EMR, which is set up to support the insurance company, not the doctor or the patient. There's way too many boxes to check, and if the doctor or therapist asks you about everything listed in the EMR, they won't have time to find out while you're actually there. And I know from personal experience that it's just about impossible to do an excellent job with the note and the patient during the visit, given the severe time constraints. As a result, there's a very high, and I dare say practically universal, occurrence of inaccuracies in patients' EMRs. And another burden is frustrations with phone calls with insurance companies, including the need for prior authorizations and peer-to-peers. They both waste valuable time for the doctor and the patient in getting required approval for needed tests, procedures, medications, etc. And oftentimes the peer is not a true peer at all. And I'm happy to have a conversation with anyone who would like further explanation of prior authorizations and peer-to-peers. And one more administrative burden, and it's what some refer to as pajama time. And some doctors don't like that term because that's not how they want to be spending. None of them want to be spending the time in their pajamas in this way. But basically, it refers to once physicians finally get home, many still spend hours updating patient charts, reviewing lab results, responding to emails, and patient portal comments. And another area is moral distress and moral injury. Moral distress is knowing the correct clinical decision, but being prevented from making it. And an example would be knowing the best medication to prescribe for your patient, yet having to prescribe several others before that medication will be approved, resulting in a waste of time and potentially adverse effects for the patient. And moral injury is conducting, witnessing, or failing to prevent actions that challenge sincerely held beliefs. And an example would be when a doctor recommends a specific test or procedure that's denied by the insurance company, resulting in harm or death to their patient. And your doctor does care about you, and these stresses take a tremendous toll. And I felt it myself as a healthcare professional. It makes you question why you went into your profession when you're prevented from making the impact you know you could if you were permitted the resources to do it. So why should patients care? Dr. Kathy Stepien has said, everyone wins when physicians are well. Currently, physicians are leaving in droves, including early retirements, deaths by suicide, changes to part-time status, and pivoting from clinical work. Medical licensing laws in some states require physicians to disclose if they've received mental health services, resulting in real or perceived obstacles to distressed doctors seeking help. This alone has resulted in multiple physician suicides. Doctors are afraid to seek help, worried about how it will impact their licensure, among other things. Doctors and other clinicians are experiencing levels of distress that put their health and the health of the greater population at risk. More than half of physicians are experiencing symptoms of burnout. Burnout is associated with poor patient outcomes. If physicians are not adequately supported, the trickle-down effect on patients can be catastrophic. If your doctor is experiencing burnout, they're not in a frame of mind to be as engaged with you or make the best decisions as when they're in a healthy state. And decreasing burnout and increasing resilience has been the goal of many workplace programs. However, the focus has largely been on individual practices, and meditation and yoga are a couple of classic examples, when the reality is that it's systemic contributors, including work overload, limited resources, administrative burdens, workplace culture, and negative leadership behaviors that are often some of the primary drivers of burnout. And to pile onto that, physicians experience disruption of sleep patterns, for example, when they're on call, and neglecting personal and family needs due to the demands of the profession. And Dr. Ashraf Salem messaged me saying, I don't think it would be an exaggeration to say that if you were to ask the vast majority of doctors in a moment of honesty, we all have really gut-wrenching stories about the toll medicine has taken on us individually, not just collectively. And in communicating with well over 100 physicians, I can say that rings true for so many. So what are some solutions? When physicians feel supported, they're less likely to be disengaged. You want your doctor to be well, so they'll be actively engaged in supporting you. And it's a multifaceted problem requiring multifaceted solutions. And of course, I don't single-handedly have all the answers, though I'll share a few things I've come to understand that would help. And one is the culture of medicine has to change starting in med school. There's so much bullying, trauma, and shame occurring at all levels, from med school to residency to attendings in the workplace. And it doesn't have to be that way. Trainees are often told, keep your head down and just keep going, which perpetuates the toxic culture. And there are known repercussions from reporting abuse and understandable fears about seeking help. Another thing, as far as a solution, would be we need to restore physician autonomy. Doctors have so much responsibility, yet so much less control than most patients realize. Doctors used to own their own practices, making treatment decisions based on medical factors. In recent years, most physicians have been forced out of private practice, becoming employed physicians for healthcare systems. As employees, doctors are frequently told how many procedures to perform, how many patients to admit to the hospital, etc. They're expected to meet certain metrics dictated by their employer, which can directly impact their medical decision-making. And we touched on health insurance requirements earlier, which influence and many times negatively impact physicians' treatment options that they can offer to their patients. And patient advocacy. It's important for patients to be good advocates for themselves while recognizing the high education level of their doctor. One example is when patients insist on a course of antibiotics when the physician deems it unnecessary, resulting in potential bodily resistance to antibiotics in the future, both for the patient and for the population at large. We all benefit from physician autonomy. When doctors are able to make medical decisions in the best interest of the patient and not have to rely excessively on the external factors mentioned above, trust is restored between doctor and patient. Doctors are able to deliver the high-quality patient care they genuinely wish to provide, and patients understand that the doctor has their best interest in mind. And along with changing the culture of medicine, changing medical education to include improved guidance on topics such as setting boundaries, navigating imposter syndrome, and the critical importance of self-care, and have those modeled by attendings. That would go a long way towards helping as well. So what can patients do? When I interview doctors and ask what they most want others to know about them, they say, I'm human too. Doctors face all the same challenges and have all the same feelings that other people do. Doctors are people too. They want people to understand and acknowledge that. They experience chronic stress, witness suffering, pain, and death on a daily basis, depending on their specialty. Patient care is very demanding. Even before anything else changes, we can all offer kindness and compassion to each other. If each of us did our best to bring that to every interaction, imagine how supported doctors and patients would feel. And it sounds almost too simple, but just say thank you in whatever way you're moved to do so. Kind gestures can include bringing a healthy snack or a treat for your doctor and the staff, sharing a personalized and sincere thank you during your visit, sending a heartfelt thank you after your appointment, remembering your doctor on Doctor's Day, which is March 30th, or any day. Any time is a good time to thank a doctor. And in conclusion, my awesome physician coach, Dr. Michael Hirsch, shared something with me that he feels underlies everything he writes and does. He says, it is imperative that doctors put their own self-care at the top of their priority list. When we feel cared for, we are better able to care for others, both personally and professionally. And I'll add to that that we all want to feel seen, heard, and valued. That includes doctors. So, Pat, thank you for listening. And I was wondering if you could think of a time when you have felt supported by doctors that you'd like to share with our audience, along with anything else that you'd wish to share.
First of all, Kim, I agree with you 100% that when the doctor's taken care of, then you will be taken care of as well, because he or she will feel good about themselves, so they can extend themselves. Having Parkinson's disease, it's a disease that slows everything down. As a result, even in speaking, I have to sometimes take time to understand what the person is saying and integrate. The doctors who deal with Parkinson's patients are aware of that. So they have to do things a little bit slower because they need for the patient to understand. As a result of that, the Parkinson's patients are spending more time with the doctors than the time that you said doctors basically 15 minutes to a half an hour they allot for a patient. The Parkinson's patient may get a little more because they need more time. I have personally experienced spending that extra time with the doctor has meant so much because I feel like they're hearing me and also they're empathizing with me. They can understand what's going on and they verbalize that. So I know that they understand what's going on. And then also just to have the doctors, as I'm walking out, saying, it was nice to see you again. You're doing well. Those things feel good. So I really think that the doctors are under a lot of stress and a lot of pressure. I agree with you. And I, as a patient, so appreciate when the doctor uh, acknowledges me. I know that he sees me and I'm not just one of many people, but I feel like he knows who I am, or she knows who I am.
Mm-hmm. Yeah,
Yes.
exactly. And a couple other things that you shared with me that I don't know if you wish to expand on is how the doctors expressed curiosity, about your condition upon meeting you, and how they've shared that they're sorry, and how both of those things really meant a lot to you.
Yeah. Well, one of the things that's interesting is Parkinson's disease. It can start with just a little twitch here or there that appears to be innocuous on the surface. So usually when I'm in a doctor's office and it's a new doctor, I usually get the question, what were your first symptoms? What did you first notice? And sometimes beyond the visit time, I spend some more time telling them what were my first symptoms. Example, for me, my first symptoms was just a little twitching of my finger. And on the surface, it appears that it's nothing and it's not something you would pay attention to. And so when you explain that to the doctor and this is not just for their records, this is more one-on-one. Hey, what happened? That level of curiosity. And that makes me feel good too, that they are curious as to what happened. And then the other thing that I do notice is they'll say, I'm sorry. And again, that's not, even though I'm there as a patient and that is the doctor. They're When I hear that, I feel that they're doing it genuinely because as a human being, they're sorry that has happened. And so the doctors have I think for me, when I talk with them, I talk with them with the understanding that they will understand what I'm saying, and I get the feedback when they say I'm sorry, or they get they are curious about what's going on beyond just the medicine.
And I think that we've both experienced that it's a true partnership in our health, right? That we feel that we've partnered with our doctors. And I wanted you on here because we're both patients. Like I need doctors that order the medications now that literally keep me alive. And you're very grateful and reliant on doctors yourself.
Yes, absolutely. I rely on the doctors so much, and they've become friends. They're like family
Hmm.
because I know that without them, I'm not going to be okay. But with them, I have the ability to be okay, and I can be okay. And when something goes wrong where I can't see it, the doctor can see it. For instance, recently my doctor said, "Oh, I think you should go and get physical therapy." And I'm going, "I'm fine. I don't need any physical therapy. I'm fine." And I did go on his recommendation. And to my surprise, I really realized once I was in physical therapy that I needed it. I was
Hmm.
off balance now. There were things going on that I had not noticed, and
Hmm.
the doctor noticed. And so I was, even though reluctant,
Hmm.
as I followed his instructions, I was able to find that there was a deficit and to get myself better. So it did not turn into something of a more of a bigger problem than it needed to be.
Sure. And to your point, I just recorded an episode that I haven't shared yet with a couple of physicians who had their own quite significant and life-threatening health challenges, but they didn't recognize them as such until they were actually happening. And what they were saying too is their patients also. And they said for the conditions that they have, they need doctors too, right? You're a nurse,
Yes,
I'm a physical therapist, and they're doctors, and we all need doctors, and
absolutely.
we're all grateful to doctors. And the one thing I've shared, and I believe even on at least one or two of my episodes, and I quote you, so I'm going to quote you here so people can see the person behind the quote. But you shared with me fairly recently that you felt like I'm giving a voice to doctors who are expected to be superhuman and not complain because of their salary. Many people don't have empathy for them because they think a doctor's life would be the ultimate.
Absolutely. They think that because a doctor makes whatever the salary is, it's a lot of money. And so they shouldn't have any reason to complain and just do your job. And they neglect to understand that doctors are human beings. And as you said, if we treat doctors well, we'll be the beneficiary of their feeling good.
Well, thank you. I can't say it any better, so we'll close it with that. And in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.